The world faces monumental challenges. It always has. But if you look around, progress is everywhere. People are coming together, imagining a better future, working to turn ideas into positive impact. Sometimes they stumble, other times they fail. But through each misstep, mishap, and mistake, there's progress, not only for the chosen few, but for everyone. Progress is making clean energy accessible. Progress makes landfill useful. Progress empowers Indigenous success, advances healthcare, protects the vulnerable, improves quality of life for dementia patients. Progress expands access to education. We've made incredible progress, but there is more to be achieved. Our sights remain forward. Progress for all.
Okay, good afternoon, everyone, and welcome to our guest lecture session today with the title of Mental Health and Wellbeing in the Construction Industry. So my name is Chandra Suma. I'm staff member at the Australia Award in Indonesia office. I will be your host today. And on behalf of Australia Award in Indonesia, we extend a warm welcome to our scholars, our Australian alumni, and also representative from the Australian Embassy and partners. And before we start, please allow me to share a few housekeeping rules to guide our session today. So the first one will be, please format your Zoom name using the following template, name/organization/ identify whether you are scholars, alumni, or partners. And the second one, please please put your microphone on mute throughout the event, unless someone from us, the MC or moderator, asks you to open your mic. The third one, to maximize the quality of your Zoom viewing experience, we encourage you to just use your laptop or desktop, or if you are currently moving around or on the commute, feel free to just use your phone. And the fourth one will be, if you'd like to ask questions for the Q&A session, please use the following link, the https://oz.link/Q&A, or you can go to menti.com and use the code 62620616. And this event will be recorded and we will distribute to all the attendees via email. And the last one will be, by the end of the session, we are going to have fun quizzes with exciting prizes from the Australia Award Indonesia office. So please stay until the end and enjoy today's session until the end of the lecture. And our today's lecture will give a broad overview of mental health and well-being in construction industry, with a particular focus on strategies to improve mental health and well-being at the individual, organizational, and industrial level. And I'm delighted to introduce our distinguished speaker for today's lectures, Associate Professor Riza Yosia Sunindyo. The Associate Professor Riza Yosia Sunindyo served as a Deputy Head of School Research at the School of Built Environment, UNSW, Sydney. And his research focuses on the work health and safety, as well as human resource management in the construction industry. And he has secured nearly 3 million Australian dollars in teaching and research grant, and has authored over 130 scholarly publications. Currently, he is a world top 2% scientist according to Stanford University. The Associate Professor Riza is also a member of both the Australian Institute of Building and the Chartered Institute of Building. And prior to his academic career, he held various roles in the multinational construction company, including project engineer, sustainability champion, and project manager. During this time, he contributed to several major developments, such as 5-star resort and an international airport. So, without further ado, I would like to invite our speaker today, Associate Professor Riza Yosia Sunindyo, to deliver the guest lectures, and the time is yours, Prof.
Thank you. Thank you for the kind introduction. So I'll just start by sharing my slides. Okay, so I'll just start directly. Again, thank you for inviting me today and giving me the opportunity to share some of my research experiences. So today my presentation will focus on building resilience, mental health, and well-being in the construction sector. I think I have been introduced, so just quickly, I am Associate Professor and Deputy Head of School Research at UNSW Sydney, especially in the School of Built Environment, and you can see my educational background there as well. I did have industry experience, so before I work as a full-time academic staff, I work in the construction industry. I started as a structure engineer, and then I, in a sense, shifted my career to construction as a contract admin, site engineer, project engineer, sustainability champion, and then project manager. Now I'm a full-time academic staff at UNSW. I have other hobbies that you can see on the screen there, and I do have my YouTube channel concerning construction research and teaching. So I share my research and teaching there. I also can be connected via LinkedIn. So if you want to connect with me, please do so. A quick intro about UNSW Built Environment. So there are 7 disciplines in UNSW Built Environment: architecture, interior architecture, landscape architecture, city planning, industrial design, computational design, and construction. I am part of the construction discipline. As a group, we do research in 3 broad areas: digital and smart, built environment, so basically how technology can be integrated in our built environments today; healthy and equitable built environments, finding the relationship between health and built environments, and how to make our built environments more inclusive and accessible. And the last one, sustainable built environments, especially in terms of environmental sustainability. UNSW itself is ranked number 19th in the world, but for UNSW Built Environment, we are first for research in architecture in the world, and we are ranked 23rd in architecture and built environment according to QS. Last year, we obtained $7.8 million of research funding, so that is the apportion value, and we are home to 7 world's top 2% scientists. So now let's go directly with the lecture itself. First, I want to introduce concerning the importance of the construction industry. So just to create the context, there are different aspects which show or demonstrate the importance of the industry economically. For example, the industry contributes to about 12% of the world's output. In Australia, it is responsible to about 10 to 11% of GDP in the country. From the social perspective, the industry employs more than 200 million people globally, and it employs roughly about 10% of the Australian workforce. So it is a large industry. It also supports other industries. It provides the infrastructure and facilities that we use on daily basis. The offices, our homes, schools, universities, the roads, even the electricity and the internet. All of them are the end products of the construction industry. And we also add values to other industries as well. Obviously, doctors, for example, they do their works in hospitals or in clinics, but the hospitals and clinics are built by the construction industry. From the perspective of environment, the construction industries and the end products like buildings and the infrastructure, they are large contributors of carbon emissions. So therefore, there are many opportunities for the construction industry to promote sustainable development by changing our practices, making the practices more environmentally friendly. And lastly, just from a well-being perspective, the construction industry contributes to positive well-being, again, by providing the infrastructure and utilities that we use on daily basis. From there, I want to introduce to you the mental health status in Australia, because the lecture today is about mental health. So this is the status for the entire country. In Australia, there are more than 3,000 deaths by suicide every year. So that is the stats from 2023. Roughly about 9 deaths per day, or 11.8 deaths per 100,000 people. About 75% of suicide cases were male. Again, this is the stat from 2023. The rate for male is about 18 per 100,000 men, while the rate for women is 5.8. So being a man is actually a risk factor of suicide. The risk of males aged 25 to 54 with no university degree is 2.6 times higher than males with a university degree. So in a sense, education is another factor of mental health problem or suicide. And lastly, just another stat. Suicide is the leading cause of death for young people aged 15 to 24. So almost 1/3 of all deaths among these young people, up from 20% in 2001. So the increase is quite significant. The environment nowadays is more difficult for young people. With that in view, the context, now let's enter into mental health status and stresses in the construction industry. So stresses obviously are sources of stress in the industry. The rate of suicide among male construction workers is about twice the rate of other male workers. So somehow when people are working in the construction industry, the rate of suicide is doubled. And we need to remember 87% of construction workers are male. And remember what I said earlier, being a man is a risk factor of suicide and suffering from mental health issues. So that is the latest data in terms of suicides among male and female construction workers. So the top table is the rates or the stats for male construction workers. So we can see clearly for non-construction workers, the rate is 13.5. For construction workers, it's basically double. Likewise for female, even though the rate is much lower, but when they work in the construction industry, the rate is also doubled. So we can see the impact of working in construction on the mental health of the workers. What are the top stressors? I did this investigation early in my endeavor to investigate mental health in the construction industry. So I collected data from both men and women. And here we can see the top 4 stressors for both men and women are the same. High level of time pressure, excessive workload, long work hours, and unpleasant nature of work. It's dangerous, dirty, and so on. All of the stresses are related to the work nature and culture in construction. And the top 10 stresses are also correlated with depression, anxiety, and stress. So if they experience the stresses more often, then automatically the levels of depression, anxiety, and stress also increase. And then, yeah, the research has been published in that paper. If you compare if we try to find the significant differences between men and women in terms of the stresses that they experience, here are the stresses with significant differences. So female, for example, they experience more social related stresses like discrimination, bullying, and sexual harassment. Men, they experience more work-related stresses, unpredictable work hours and shift, because probably they are working on site, and so therefore their work hours are unpredictable. Financial difficulties, because usually they are the main providers for the family, so therefore they are concerned more with the financial aspect of the family. Working night shift and also unfavorable equipment conditions, like what I said earlier, because they tend to work on site. But at least if we see these stresses, the means are relatively low, so they are not the key stresses experienced by men and women working in the construction industry. But at least we need to be aware that there are differences in terms of the stresses that men and women experience. So that is the condition in Australia. So then I was like, okay, let's try to collect data from developing countries. So therefore, I did this research in China. The same story in China, construction workers, they tend to work long hours, 10 to 12 hours per day, sometimes for 6 days. And the top stressors, which they said are these 7 stresses. Long work hours, the same story. Inflexible work schedule, basically they need to be on site or in the office within certain periods of time. Working night shift, and because of all the pressure, they feel that the salary is not enough. Again, number 5 is unpredictable work hours or shift. And again, because they are so busy at work, they don't have time, personal time for themselves and also for their family. So therefore, number 6 and 7 are work-family conflict, dual career challenges, and excessive personal responsibilities. So the same story, basically, in developed countries like Australia and in developing countries. Well, this is in China. How about the outcome? So what is the impact of those stresses on the mental health of construction workers? So this is the study in China. The prevalence of moderate to severe conditions of depression, anxiety, and stress is presented here. The current research, so this research, which I did, we can see among all the respondents, 36% of them actually experience depression. 33% experience anxiety and 14.5% experience stress. The prevalence rates are higher than the other population groups. So Chinese general population, Chinese medical care workers, medical care workers, they're supposed to be working in a stressful environment, but the prevalence rates are lower. Even during lockdown, as you can see, the levels are still lower than in comparison with working in the construction industry. And again, and then, okay, so let's try to collect more data. So this one is the data from Nigeria, but specifically for tradies. So those people who do laboring work on site. These are the top stresses: increased work speed, a lot of work pressure, and then the time pressure, long work hours. Again, it's always mentioned by people working in construction. Job insecurity, especially for tradies. I think it makes sense because they work from one project to the next one. So therefore, there is no guarantee that they will have a job after they complete one project. Physical illness due to work pressure because they are doing the laboring work. So therefore their physical health is affected. And the last one is work overload. So the same story again. The work culture and the work environment in the construction industry are the sources of stresses for construction workers. The impact of those stresses on the mental health status of tradies in Nigeria is presented here. 72% of the respondents had depression, which is a very high rate. 23% of those with depression experienced suicidal ideation within the preceding 2 weeks. And the stresses were strongly associated with depression, and those with the least work experience were more anxious and depressed than others. So these are some of the findings in the Nigerian construction industry. So basically, mental health, in a sense, the message is that it is a global issue. Not only affecting people, mental health also has economic impact. So it is estimated in Australia, the cost to economy because of workplace injuries and then mental illness, suicide, long work hours, and lack of diversity is about $8 billion. And you can see how the cost is classified into different causes. So therefore, it is a serious issue, and there is an urgent need to improve the mental health in the construction industry. So what can we do? Okay, so let's start with individual level intervention strategy. So depending on the workers themselves to improve and maintain their mental health. Coping strategies, that is the most common intervention at the individual level. So coping strategies basically can be classified into problem-focused, emotion-focused, and maladaptive coping. Problem-focused means the workers are trying to do something to address the problems directly. So basically to deal with the stresses. And usually this is the best coping strategy. The second group is emotion focus. So the focus here is to manage the emotion, making sure the emotions are not negatively affected by the stresses. It's useful when the stresses are not under the control of the workers. If they cannot do anything about the stresses, then they need to focus on themselves and manage their emotions. And the last group is maladaptive coping. So basically, if they use maladaptive coping, then their mental health will get worse. I collected data in Australia, and we can see there are different coping strategies. So basically, workers in Australia are doing the right thing already. So they use either problem-focused coping or emotion-focused coping. And you can see the differences between male and female as well. The same thing. So they, both male and female, tend to use more problem-focused and emotion-focused coping. So they do the right thing. There are differences. Female, they tend to use more seeking social support and venting of emotions, while for male, interestingly, they turn to religion more than female. The problem is, even though they do the right thing by using problem focus and emotion focused coping, but it doesn't impact on their mental health positively. So among female, at least active coping, which is problem focused coping, has a negative correlation with depression and anxiety. So we can say that if they use problem-focused coping, especially active coping, there is a potential that it can reduce their depression and anxiety levels. But among male, we cannot find such a relationship. So even though they use problem focus or emotion focused coping, they cannot improve or they cannot reduce the levels of depression, anxiety, and stress. And it's very clear when they use maladaptive coping, for example, like behavioral disengagement, denial, alcohol, and drug, and the same for female and male. When they use maladaptive coping, then it will reduce their mental health status. So the levels of depression, anxiety, and stress increase when they use maladaptive coping. I did the research in China as well, the same story. They are doing the right thing as well. So they tend to use problem-focused coping or emotion-focused coping, and they avoid maladaptive coping. But the same story. Problem-focused and emotion-focused coping have no relationship with mental health symptoms. So even though they are doing the right thing, they cannot improve their mental health if they only use problem focus and emotion focused coping. Yeah, at least it doesn't get worse, but it doesn't improve either. Maladaptive coping were rarely used, but if they use maladaptive coping, it will increase negative mental health outcomes. So basically the same story like the case in Australia. So what do we learn? As I said earlier, work culture is the source of top stresses. In this case, individual coping strategies are less effective to address the stresses because work culture is outside the control of the workers. So therefore, there is a need to change the culture. But changing culture requires the involvement of influential stakeholders like the government, through their policies and legislation, major construction clients because they set project objectives and they have the budget as well. Large construction organizations because usually they have the resources to do so, and also construction industry associations to slowly change the culture and provide advice to construction stakeholders. Still within the individual level intervention, I think there is a need for construction workers to be aware of mental health issue and to improve their mental health literacy. So first being aware, and then they need to know how to improve and manage their mental health. In this case, there is a dual continuum theory of mental health. Having good mental health, you can see in the explanation here, is not only about eliminating mental illness, but also the promotion of mental well-being or a flourishing mental state. So you can see we have 4 quadrants here. So mental health has 2 components. The first one is about mental illness, and the second one is about mental well-being. Obviously, the goal is to have low mental illness and to have high mental well-being, which is called the flourishing state. So therefore, because we have the concept of well-being, I also did research concerning well-being. So well-being has 4 dimensions: emotional well-being, feeling happy, feeling satisfied with life. And the second dimension is psychological well-being, accepting the situation, and then having enough autonomy to make decisions, opportunities for personal growth, and so on. The third dimension is social well-being, social growth, social acceptance, increasing the networks. And the last one is spiritual well-being. So basically how the belief or the religion of the workers match with the environment. So these are the 4 dimensions which we can use to assess mental well-being. Because we know how to assess mental illness, for example, using depression, anxiety, and stress, but sometimes we don't know how to assess mental well-being. So therefore, I did this research and identified 4 well-being dimensions. Okay, so that is the individual level intervention strategies. And as I said earlier, of course, the workers need to know, but it's not enough. There must be other higher levels intervention strategies to support construction workers to make the whole effort more effective. There are many ways, but I just want to focus on the first one is prefabrication. So basically changing the way people work in the construction industry, because people tend to work on site, right, in situ. And then when people work on site, there are many factors which can affect the way they work, especially the external environmental conditions. For example, when the weather changes, then, well, of course, the work will be affected. Again, when they work on site, usually the site can be quite constrained. There are many workers there, many materials there, many equipment. So as a result, it can be less safe. And also working in such an environment also can affect their mental health. So therefore, we have another way to do construction work, which is called prefabrication. So instead of working on site, doing everything on site, some of the works are transferred in a factory in a more controlled environment. So therefore, it's safer. It is not affected by the external environmental factor. And as a result, it can improve the mental health of the workers as well. So that's the meaning of prefabrication. Doing some works in a factory, and then they build, can be a big component. The big component is transported using a truck and then being brought on site before it is installed in the project. So that is the concept of prefabrication. The example here is the construction of houses. The houses here, they are using bathroom pots. So the entire bathroom units are manufactured in a factory. And then you can see from the picture there, the entire bathroom pot is transported on site, and then using a mobile crane or a tower crane is being placed in the house. 52 bathroom pots in 26 homes in Melbourne. That is the internal finish of the bathroom pot. So basically, completely finished, just simply being placed on site. So this is called volumetric prefabrication approach. The manufacturer for this bathroom pot is Zinc. In traditional bathroom construction, there are so many people involved just to construct bathrooms. The project team, for example, the project manager, site manager, project engineer, site supervisor, health and safety coordinator, they all need to be involved in procuring the services of the tradespeople. So there are 9 trades involved in the process. The plumber, electrician, plasterer, joiner, glazier, waterproofer, tiler, tile supplier, and fixture suppliers. So they need to do a tender process to get quotes from all those trades, and then they need to be coordinated and they need to be managed. So there are eight activities to engage and manage trades: the tendering, purchase order, schedule management, document control, calls and emails, inductions, and health and safety management. So it's a complicated process to manage just to construct bathrooms in houses. The quality, of course, the project team also needs to inspect and do quality control activities: inspection, warranty, certification, and defect management. Overall, to build those bathrooms, the project team had to do 460 scheduling tasks, 61 hours of phone calls, 930 emails sent, 130 hours of meetings, and 360 hours of inspections. So it requires a lot of time, a lot of coordination, and a lot of workload. In comparison to prefabrication, the trades, coordination and management and quality, all of them are managed by the manufacturer, which is Sync, which I mentioned earlier. So therefore, the process is much simpler. So here is the comparison. Scheduling, if we use traditional approach, 460 notifications. So when they use prefab, they reduce the notifications number by 78%. So from 460 to 104. The time to calls the trades from 61 hours can be reduced to 15 hours when prefabrication was used, 75% reduction. Emails sent from 930 to only 52, 94% reduction. Meetings, 130 hours, only 78 hours for prefab. And the time spent for inspections, 360 hours and only 104 hours for prefab. Much easier in terms of coordination, and this can reduce the workload and also can reduce the work pressure. Some more comparisons, so entries and exits. So basically we use a video to record the movement of workers in prefab and also in traditional constructions. In traditional construction, when workers build bathrooms, they enter and exit the bathroom 21,000 times. So worker went in to do something, to install something, and then they went out, went in and went out 21,000 times. When they use prefab, it can be reduced to only 520, 98% reduction. Obviously, when we can reduce worker movement, then it can improve health and safety. The number of workers can be reduced from 3,000 to only 156. The man hours from nearly 3,000 hours to only 37 hours to install all the 52 bathrooms. Days in construction also can be reduced from 109 days to only 7 days. Much shorter period of construction. Then we also compare the experience of the people working in prefab and also in traditional construction method in terms of the stresses that they experience. And we can see clearly workers who work in prefabricated projects, they have lower stresses, industry-related stresses. So based on the p-value, we can see the significant differences. So basically, prefabrication can reduce physical injuries. Prefabrication also can reduce the feeling of fatigue or tiredness. Another one, poor working conditions. So prefab can improve work conditions. And prefab also can reduce discrimination and stigma attached to mental health. So this is industry-related stresses. Another one, management or organizational stresses. Again, we compare traditional and prefab. There are so many significant differences there. Prefab can address the stresses of inadequate provision of job resources, unclear supervisors or management directions, can improve communication, can improve the shift roster. What else? Reduce work overload, undue and excessive criticism, lack of task autonomy, lack of participation in decision making, poor worker support mechanism, and poor feedback mechanism. So there are many things that prefabrication can do to improve or to reduce the stresses experienced by construction workers. Another one is personal stresses. Age discrimination. So prefab can interestingly reduce age discrimination because by using prefab, the workers will depend less on their physical strength, because prefab can reduce manual labor, so therefore it can address problems related with age discrimination. Lack of opportunities for further learning, so prefab can provide opportunities for further learning because they learn new ways of doing work. And prefab also can improve work-life balance because we can reduce the workload and reduce the duration spent on site. The benefits of prefabrication: the standardization of processes, everything in a factory following a certain design standard, less congestion on site because some of the works are transferred into factories, less weather dependence. Obviously, when working in a factory, it will not be affected by weather conditions, cleaner construction, ample space for task execution because, again, the work is done in a factory, reduced trade overlap, same story, being done in a factory, easy identification of dangers in a controlled environment, reduction in dangerous tasks, especially what I said earlier, we can reduce the amount of manual handling. Actually, manual handling in construction is the #1 source of injury, especially the musculoskeletal injury. Fewer manual works and fewer site accidents and injuries. So all those benefits can affect mental health positively. Another one, just again, what I said earlier, there are many ways to improve the work conditions at the project level, but I just want to give an example of prefab. And another one, noise disturbance. Managing noise actually can improve mental health as well. So I did this research. So I capture the noises on site. I compare the experience of workers doing finishing work and doing structural works. So you can see the noise level of finishing work is much lower than the noise level at the structural works. Another fact, all workers in the case study project wore earplugs when working. So at least they wore PPE. They are doing the right thing. Structural workers, interestingly, experienced more noise disturbance at work. And the noise disturbance can cause them to experience negative emotions. So here we can see the comparison between structural workers and finishing workers. The underline are the significant differences. I often feel scared and anxious without any reason. So again, the structural workers experience this negative emotion more often than finishing workers. I often feel confused, the same story, and I often avoid other people. And not only negative emotions, my research also found noise disturbance can increase unsafe behavior. So that a simple way, it's not enough to simply ask workers to wear PPE, but there must be higher levels interventions if you want to improve the work condition and eventually the mental health of construction workers. So the lessons learned from this noise management research: noise disturbance increases negative emotions and it causes emotional distress. Noise disturbance and negative emotions eventually also increase unsafe behavior. As I said earlier, wearing PPE, asking workers to wear earplugs is not adequate. So therefore, there is a need for noise management at the project level. Conducting noise assessment by identifying activities and the noises which they may generate, predicting noise levels, and then implementing noise control mechanisms, and also monitoring the noise level to ensure whether the control is working or not. So just again, another example how we can change the way we do work on site, which can eventually improve the mental health of construction workers. So that is just a couple of examples, intervention at the project level. So now organizational and industry level intervention strategies. In Australia, we have an organization called Mates in Construction. This is a charity established in 2008 with the main aim is to reduce the level of suicide among Australian construction workers. So you can see there the goals and activities of Mates in Construction. So in terms of the goals, the first one, they want to raise awareness of suicide as a preventable problem. Again, to build the awareness first, and that suicide is real and it is preventable. The second one, building stronger and more resilient workers, improving their awareness and also improving their mental health literacy. Connecting workers to the best available help and support, because sometimes the workers are not aware of the support available, and they also partners with researchers to improve mental health. Some of the activities, they train workers to improve their mental health literacy. They train volunteer connectors and assist workers to support other workers on site. They also have field officers to support the volunteers, and they provide a support line and case management to workers who need help and support. So workers also can contact them 24/7 to receive support. So this is an example of industry level strategy to improve mental health in the construction industry. Another way is, as I said earlier, the workers, they can't do it by themselves. Other stakeholders should be involved as well. So involving stakeholders to improve mental health. Lack of awareness of the availability of interventions. So first, we need to make the workers aware of the support available. And to make them aware, we also need the support from other stakeholders to make the workers aware. And the second one, poor help-seeking behavior. So in some cases, the workers are actually aware of the support, but they don't want to use the support available. So therefore, again, we need stakeholders to explain to them, hey, it's okay if you want to help, if you want to use the support available, it's okay. It's understandable to create such an attitude, such an environment that talking about mental health is acceptable. Making interventions more attractive through understanding young construction workers' stakeholder preferences. So in this research, I focused on young construction workers. So therefore, we want to know how to engage them better so they can improve their mental health. So we did 21 interviews. We collected 445 questionnaire data from young construction workers, and it is published in this book. So we found that the most preferred stakeholders, so for them to communicate, to talk to young construction workers, interestingly, the most preferred stakeholder, number one, is academia, especially teachers at school and also university lecturers, because of their closeness to youth. So they are actually more willing to listen to their teachers and lecturers. And the second one, the second preferred stakeholder is social media, understandable among young people. And we need to be aware of this one as well if we want to engage them. The third one, young construction workers and youth activists, because they feel connected with them. So these are the most preferred stakeholders to engage young construction workers concerning mental health. The least preferred stakeholders, the first one is occupational health and safety regulators, because they are perceived as ineffective, invisible, and they are weak enforcers. They also don't like government agencies because they have negative perceptions on them, and there is a lack of trust between government agencies and young people. There are also other stakeholders, construction stakeholders, their employers, family and community, and also health professionals. They are still okay, not as bad as the regulators and government agencies, but the best or the most preferred stakeholders are academia, media, and other young construction workers. So what should we do? So now we know their stakeholder preference. Understand preferences to engage workers and improve mental health interventions, not only, so this does not apply only to young construction workers, but we need to do the same thing for other workers. We need to understand their preferences so we can engage them better, and eventually they are willing to use the interventions available to improve their mental health. The second one, we can start mental health literacy as early as possible. We can do it at school. And the third one, government agencies, because young construction workers dislike them, then they can engage young workers. They can use social media. They can use youth activists to support intervention efforts. So rather than doing it themselves, the government can engage other stakeholders who can then engage young construction workers and talk about mental health. Another initiative at the industry level in Australia is called Culture in Construction. So there is a task force called the Construction Industry Culture Task Force. This is a collaboration between the construction industry, the New South Wales and Victorian governments, and leading academics to develop a culture standard. So a better standard to work in the construction industry. They basically focus on 3 areas. The first one, time for life, better work hours, and flexible work arrangements, because those are basically the key stressors. The second one, well-being, improving well-being, assessing and managing health risks, the stresses, and also promoting well-being. Remember the 4 dimensions of well-being I introduced earlier. And the last one, they also focus on diversity and inclusion. Make everyone welcome, suitable amenities. A simple thing, for example, on site, sometimes, even though they are female workers, but somehow the toilet facilities are only for men. So just by a simple thing, providing suitable amenities can improve the experience of workers, and addressing gaps in pay and representation, basically attracting more women to participate in the construction industry. An effort to improve mental health and implement the initiatives I mentioned earlier is a project called Project 5, a weekend for every worker. So in Australia, usually construction workers have to work 6 days a week. So it's a long hour, so therefore they don't have time for their families and also their personal time. In this project, the Concord Hospital redevelopment by Health Infrastructure New South Wales, the workers only work 5 days a week. The contractor is Robert Sco. So the contractor submitted an alternative tender for a 5-day work week program and price. So basically they submitted 2 tenders. The first tender is the normal tender, expecting workers to work 6 days a week, and the alternative tender. In the alternative tender, the workers have longer work hours on Monday to Friday, but then no work on weekends. So the total number of hours is still the same for the entire week, but they have longer work hours on Monday to Friday. In the alternative tender, the contractor added 1% to the contract price. So basically, it's 1% more expensive. And the duration is also longer, 12 work weeks to the theoretical 6-day week program. So if they do the 6-day week program, they can complete the project 12 weeks earlier. But in reality, the contractor managed to complete in only 7 additional weeks using the 5-day work week arrangement, shorter than one of the alternate tenderers' 6-day week program. So another contractor actually submit the usual 6-day week program, and their 6-day week program is longer in terms of the total duration with the alternative tender submitted by Robert Scott. So this project required a massive commitment from the client as well, health infrastructure, because it's more expensive and it's longer. But the contractor explained, hey, you are constructing a hospital because you want to improve the health of people. If the workers who construct your hospital suffer from mental health issue, how do you feel? We also need to protect the mental health of the workers who construct the hospital with that has a purpose to help people improve their health. So with this argument, health infrastructure accepted. Okay, let's give it a go. 5-day work week program and price, even though it is more expensive and it is also longer. The outcomes, most workers preferred a 5-day work week over either a 6 or 7-day work week arrangement. Next of kin, basically their spouse and their families, notice improvements in their partner's mood and well-being. More opportunities for next of kin, the family members, to find employment, because in traditional construction work arrangement, one spouse works long hours. As a result, the other spouse has to be responsible for the families and the house chores. So therefore, the other spouse cannot work. In this 5-day work week arrangement, because in a sense, the work duration, or not the work duration, because there is more free time for the spouse working in the construction industry. Actually, this provides time for the other spouse to find employment. And this leads to better quality of life, reduced mental distress, and even fewer injuries. And here we can see the comparison between Project 5 and the usual project with 6-day work arrangement. In all dimensions, the workers are more satisfied when they work in Project 5. So this is just a short video showing Project 5 and the view from the workers.
The cost of time now is negligible. And so we are an industry, when we give an inch, it's gone forever. And we need to recalibrate. We need to stop shouting safety and whispering health. So I'd love to see the industry change to 5 days a week. It will bring more people into the industry, it will bring more women into the industry, it will be a more sustainable industry. All of those things are good.
The driver for me personally is making sure that we send every worker home safe every day. Suicide rates in the construction industry are tragically high.
The more companies that are doing it, the more people get used to it, and that will get built into what we do and how we do over time.
I've got 3 young boys, and basically for their whole life I've never really been able to watch them play sport on a Saturday morning because I've been at work. So last year was the first year I got to watch my kids play sport every Saturday, which was amazing.
I've got 3 kids. I have them on my heart out. It's the last thing I want to see before I put my heart out on. It's the reason why I'm here. So yeah, that's it.
So I guess a 5-day work week would mean we get to spend more time with him.
We know that mental health now is so important and part of construction safety and worker safety. I'd like to think that through this we can prove that a 5-day week is successful. It's not more costly, it is efficient, it's not costing program, and that we can make it the business as usual for the construction industry of the future.
So the recommendations based on Project 5, the clients, starting from governments, they should require a 5-day work week on their sites, assess schedules in tenders to ensure no adverse impacts on the health and well-being of workers. So basically making sure the schedule is reasonable. At the industry level, the construction industry, they need to start prioritizing mental health and well-being as well as physical health and safety. Mental health and well-being training as part of White Card. So White Card is like a compulsory training before people can work in the construction industry, and invest more time in the planning phase. Again, making sure the budget and the schedule are actually reasonable to reduce the workload pressure on the worker. So finally, if I want to summarize everything, mental health strategies at the individual level, first, we need to build the workers' mental health awareness. They need to know mental health is an issue, it is a reality, and we need to educate them concerning mental health and how to manage their mental health. Even understanding coping strategies is also important. And it's important for the workers themselves to support each other. So there is a need for such a culture to support one another. At the organizational level, technologies, prefab can change the ways of working on site, can improve the work environment, which eventually also can improve mental health. Being aware of the risk factors and the stresses, implementing well-being initiatives, and even attracting and retaining women can be a way to improve mental health and to improve the culture in the construction industry. At the industry and national level, awareness campaign, but in doing so, the government should involve preferred stakeholders to engage construction workers, government projects as role models, as the case study I showed earlier, the 5-day work week can be done in government public projects. They can set certain standards and regulations. In Australia, for example, now mental health has been legislated. So construction companies, well, not only construction companies, all companies should pay attention on the mental health of their workers. And they can start mental health literacy at school with a goal so everyone in the construction industry can reach flourishing mental health status. That's the last slide. Thank you. I'll stop sharing.
Right. So thank you so much for your lecture, Associate Professor Riza Yosia Sunindio. I'm sure not only me, the audience took many important notes from your lectures, and we would like to welcome any question related to the lectures given. And feel free to submit your question using the link provided in the chat box from the teams, and you can also use the QR code show in the Zoom. And yeah, we have received some great question already in the box. So now let's have the Mentimeter on the screen with a total question of around 6, I guess 8 now. Yes. So let's start with our first question, shall we? Right.
Oh,
All right. The first one, how
yes.
can employers in the construction industry foster a culture that encourage openness about mental health without fear or stigma? We know that as a man, there's like a stigma about you need to be strong all the time and etc. And what do you think about this one, Prof?
Oh, okay, thank you. So I think first, obviously, the top managers and the supervisors should set themselves as examples. In some cases, the company can say all the nice things. They have proper policy, proper everything on paper, but in reality, the culture itself is not like that. Even though they may have initiatives, but people are not encouraged to take the initiatives, or even if people take the initiatives, then they feel that they are being bullied by others. So first, the top managers, the supervisors, I think they play important role to create such a culture so people feel comfortable to use the support systems available. And another thing is like what I said earlier, we need to know the preferred stakeholders of construction workers. So how we can engage them better, first to make them aware of the support mechanisms available, and in a sense to convince them to use the support systems available. So we need to understand their engagement preference so they can be engaged more effectively.
All right, thank you so much for your answer on that. I think that's quite clear and really useful. And the next one, work culture is the source of top stressor. So as employee,
Yes.
how can employees survive in a toxic work environment, especially when the leadership makes unwise policy? I think it's quite relatable to almost everyone. Please.
Yes. Very good question. It's very hard to answer this question. I mean, because it is outside the control of the workers. So in this case, the only thing that the workers can do is just to implement the coping strategies. So understanding what I said earlier, the same thing, the problem-focused coping and emotion-focused coping. Because the toxic work environment, again, it is really outside the control of the workers. So the only thing they can do is just to implement specific coping strategies. Another possibility, at least in Australia, there is a way to do so, is to report the situation to the government. So there is a governing body which provides or which allows workers to do so. So if there is bullying or harassment in the company, then the workers can report to the external party. But I understand that such a support mechanism is not available in all countries. Yeah, but yeah, that's difficult. Obviously, another option is just to quit. But again, this is not an option for many because they depend on that particular job. So going back to using proper coping strategies, to me, is the only way in this case.
Yeah, we need to start helping ourselves first. Thank you, bro, on that. So the next one. So how is stress managed by individual with distinct cultural background, MEA, SEX, etc., compared with local or native workers in the construction sector? So the worker from the outside of the the local construction site.
Yeah, yeah, okay. Because I'm not quite sure what is the meaning of MEA and SEA. That's Southeast Asia. Anyway, yeah, but when the workers have different cultural background, yes.
I think
So
MEA Middle East Asia. Would that
I
fit?
see. Okay, okay. So yes, you are correct. One size fit for all approach is not working. So we also need to understand the influence of cultural backgrounds, especially at the organizational level and also at the industry level. We need to understand the cultural backgrounds and then implement tailored support mechanisms for them. If I can use a simple example, the Muslim population, for example, during the Ramadan day, of course, many of them have to fast. So there a certain adjustment is needed to ensure that they can maintain their well-being. Another example, even between men and women, the support system for men and women should also be different because they have different experiences, they have different ways of working. So first, we need to understand the stresses that they face. So therefore, all my research on mental health started with understanding the stresses. by understanding the stresses, then we can start implementing certain mechanisms to improve the work environment. But at least from my studies, from my research, it seems like all the stresses are similar. The top stresses, maybe not the other stresses, but the top stresses are similar. All of them are related to the work culture in the construction industry. So therefore, to me, I think we need to tackle those top stresses first. But I agree. Cultural backgrounds, definitely we need to pay attention to.
Right. Thank you so much for your answer on that. I think let's just move on to the next question. So it's from Agil, a student from UE. I would like to ask how to differentiate between stress-related illness and common illness. That how can we measure stress index? So it's quite
Ooh,
interesting question.
good question. Okay, I'm not a a clinical scientist, so probably I'm not the best person to answer this question. I guess from my own experience, probably I need to understand why I feel how I feel. So if I feel anxious, if I feel stressed out, then I need to consider, okay, what is the source of my feeling? Why do I feel anxious? Why do I feel stressed out? And then from there, I try to do something to address the source of the stresses. So in terms of differentiating between stress-related illnesses and common illnesses, yeah, I don't have the answer. But I know that actually when people are overstressed, eventually it can affect their physical health. Then in terms of how to measure the stress index, we do have different stress scale available out there. A simple example is the DAS scale, the depression, anxiety, stress scale. So that is just one example how we can measure our stress level. But there are so many other instruments available out there.
Right. Thank you so much for your answer on that. So let's just move on to the next one. So, Prof, do you have any idea how to measure the effect of mental illness and any form of mental health problems, specifically to productivity loss? I think it's
Okay,
a practical question.
good. Yes, I think earlier in my presentation, I mentioned the cost of mental health issue is about $8 billion annually in Australia. So some ways to measure that one is because in Australia, absenteeism, for example, sometimes people can say, okay, I cannot work today because particular reason. So using this kind of data, they can link or they can find the relationship between mental health problems with productivity loss because the people are not working because they take leave. Another way also, what do I want to say? Yes. So yes. So the same thing. The workers in Australia, they also can submit a compensation claim. So if they can justify, hey, my workplace is not so good, so therefore it causes me to suffer from something. Can be physical injury, can be also psychological injuries. Then when they submit a claim, this will be recorded, and then we can find the relationship between that claim and the productivity loss and the economic impact of the illness. So I think that those are just a couple of examples how we can find the relationship between mental health problem and productivity or economic loss.
Right. Thank you.
Data, basically, we need to capture the data first. Otherwise, without the data, we can't establish the relationship.
Right. Thank you so much for your answer on that. So let's just move on to the next one. Right. For countries or sectors that have not yet prioritized mental health, what would be the most effective first step at the organization level to reduce pressure among workers? Program or facilities? What do you think will be the first one that the in organization level need to address first?
I think should be baby step. Like what I said earlier, just a simple example, proper amenities on site for both men and women. If something like that is not provided, then how can we support our workers? Providing, again, another simple example, providing appropriate accommodation for the workers. It's another way. Providing proper remuneration or salaries for the workers. That's another way. Even providing PPE. That's another simple way to support the workers. So baby steps. Then, if the organizations would like to implement a more comprehensive way to improve the mental health of the workers, then they need to conduct a business case. They need to show the benefits of doing so and the impact on the economic performance of the company. Because to be fair, construction companies are businesses, and the main purpose of businesses is to make money. So therefore, developing a business case to show the benefits of improving mental health, improving safety on the economic performance of the companies, I think this is the way to go if the companies would like to go bigger in terms of implementing particular initiatives. But baby steps, slowly, and then the culture can be improved. And again, governments also play a role in this endeavor.
Right. Thank you so much for your answer on that. I think that's quite really clear. So, are there many cases where mental health issues lead to physical illness in the case of construction worker and engineering services? If yes, what is the most common illness that can be prevented?
Okay. This is not my main focus, and I haven't done any research in this area, but I did read some other research studies trying to link mental health and physical illness. As far as I know, mental health, especially prolonged mental health issues, eventually it can lead to what is the technical word? Okay, basically related to heart problem. So heart attacks, strokes. Those are some outcomes of experiencing prolonged mental health issues. If yes, what is the most common illness that can be prevented? Yeah, unfortunately, I can't answer that question. This is not my expertise, but it has been established that prolonged mental health problems eventually will lead to physical illnesses. And again, this shows the importance of focusing on improving the mental health because it can also reduce the appearance of physical illnesses.
Right. Thank you so much on your answer. Let's just go to the next one. Could you please describe how lack of diversity affect the mental health and increase the number of suicide in your research area?
Okay. So at least in Australia, we are suffering from labor shortage in the construction industry. So we don't have enough workers to work in the construction industry. As a result, everyone is under pressure because we don't have enough people to do all the work. But then the industry cannot attract women. So we miss the talent of the 50% of the population. So if we can attract just some women to work in the construction industry, then this can reduce the workload pressure in the construction industry because we need more people to enter the construction industry. So that's one thing. by having more people, automatically we can distribute the workload better. The second one, women actually have different ways of working. The culture in the construction industry is very masculine. So therefore, it's very competitive, it's very aggressive, and actually it has been proven such a culture is bad for mental health, making everyone under pressure. Women have different ways of working. So by having more women, slowly, such a culture in the construction industry also can be improved. And therefore, eventually, that can positively influence the mental health in the industry. So those are the two things how having more women can actually improve mental health in the industry.
All right, thank you so much for your answer on that, Prof. Riza. I think next one. Could you please advise on how to change the stigma in some working environment? A person who is affected by work-related stress is perceived as unprofessional worker. I think that's also relatable to many people. Could you please answer that?
Yeah, I think this is similar to the first question, right? So it should start from the top management and then from the supervisors to create such a culture, but also industry bodies and the governments, they need to keep sending the same message that mental health is a real problem. Mental health should be accepted as one issue working in the construction industry, and then slowly that can change the culture. This is not overnight and then suddenly the work environment can be better. Again, baby steps. Now many of you hear this matter of mental health, so you can be communicators to people in your workplace. Slowly, don't try to push too hard. Slowly, just to make people aware concerning mental health, develop the workers' mental health literacy, and then slowly the entire culture also can be changed.
Thank you for your answer on that. So I think for our scholars, for Australia Award scholars, you are the change agent. So it's time for you to change the cultures and the industry. So yeah, let's go to the next one. Do we have more? Right, we have more. What the workers' job level, which the suicide is the most? I think. What do you think, Prof? From your data?
In Australia, the tradies level. So basically like the carpenters, the operators, the machine operators. So those who do directly the laboring work, they have the worst level when it comes to suicide. So it means they have higher suicide level. So the blue collar workers. Just to clarify, concerning attracting women and the blue collar workers, in Australia, actually, they are well paid. So just because in some countries, people actually look down on those tradies and those workers. But in Australia, carpenters, for example, or plumbers, electricians, they are well paid. Their salary is really high. It's a good job for people, but still, because of the pressure, the work environment, the masculine culture, so they suffer the most as well in terms of their mental health. And remember, in that, the tradies, for example, they have the lowest percentage of women as well. I think among tradies, only 2 to 3% are women. But at the management level, roughly about 14% are women. So at the management level, clearly the culture is a bit better if we compare with the culture at the tradies level. So I think even like that is a simple example how diversity actually can change the culture and the ways people work.
All right. Thank you so much for your answer on that. So the next, do you have next question? Yes, we have. So this is yeah, how to face toxic boss. So how many companies still discriminate the employees who have mental illness. Many employees get fired when company knew that they have mental illness. I think it's quite relatable in Indonesia. So what do you think about that?
Yeah. I think also similar, like probably the second question, right, concerning toxic work environment. Again, this is outside the controls of the workers. So at the individual level, the only way available is basically implementing individual coping strategies, focusing on problem-focused coping and emotion-focused coping. At the same time, slowly, that person also can be, like what you said, change agent in that company. It is not always possible. If that's not possible and there is no option to quit the job, then the only option available is to focus on your individual coping strategies, unfortunately.
Right. Thank you so much for your answer on that. So the next one, I think that's all. Oh, all right. So is that any more question in the chat box? I think we have three more. Oh no, we
I
have
think they
answered
have,
that.
yeah.
Yeah, we have
Yeah,
answered
yeah.
that question as well. And yep, I think that's all for all the question. So it's time for fun quiz. Now, would like to conduct quizzes and award merchandise to three winners. So please join us in the Mentimeters through the QR code provided in the screen. Yes, you can also use the link provided in the chat box as well. So before we start, please write your email address and real name. So it will help us to identify you and eventually send you the merchandise. So we will contact the three winners for our quizzes. So yeah, let's go, everyone. We have 40-ish participant. I hope half of you can join the quiz, so you can win the exclusive merchandise from Australia Award. Yep. Let's go. Let's write your email on that. So we have 9, 11, 12. Oh, it's coming up. 15. Right. Okay, we got 18, 19 now. Should we start? Sure. Let's go. Are you ready, everyone? Let's go for the first question. What is the main source of stressor experienced by a construction worker? Let's go. It has been lectured in the lecture. Yes, we got 15 people right. Poor work culture is main stressor. Question number 2. Following are benefits of prefabrication that can contribute to improving mental health. Exam. So it can be. It is one question only. Only 3 is the transfer. So I think this trick is main candidate for the winners. Okay, the third question. Who is the most preferred stakeholder for promoting mental health among young construction workers? Who is the preferred stakeholders? Know the answer? Yes, the young construction worker will prefer their own peers. So other young construction workers the answer. So the fourth one. Prof. Riza served as deputy head of school research at the Built Environment UNSW Sydney. Is it true or false? We have mentioned it a million times in the first one. Yeah, it's true. So four of you still answer it false. So the last question, let's go. What is the main icon featured in the UNSW? It's easy answer. Quick, Google. Yes, it's a lion in a rising sun. That's right. Who is the winner? Yeah, I think that's the first question. Alright, we have Krishna. Okay, we have Krishna, the first one. And the second one, we have the data. I think it's Zeta and Thomas. Isn't it? Alright. I think the team will verify that who will be the winner for the quizzes. So I think we will identify the winner later on. So or the team would like to identify the winner first in the chat box. So I think we have Krishna, Thomas, and the other one I forgot. Yeah, Krishna, Zeta, and Thomas. So we will contact you, or you can contact us through the email and also the number provided. I think it contains WhatsApp all as well. So yeah, please contact us to claim your exclusive merchandise from Australia or in Indonesia. So yeah, please contact us because of our team sometimes has difficulties identifying your real name and your contact. So yeah, please just let us know. And so now I would like to invite everyone to a group photo. And we would like to be grateful if you could please turn on your camera for the group photo, and Mas Robert will help us to capture the moment. So in Indonesia, they say that it's not happen if there is no photo. So let's let's take a photo first. If you can open your camera, that would be great. Okay, I think yeah, I think we almost got everyone who can open their camera. So over to you, Mas Robert.
Okay, thank you, Mas Chandra. All right, everyone, on the count of three, yeah. 1, 2, 3.
Smile.
Yes, smile. Okay. The last screen. 1, 2. Wait, snap. Okay, thank you, everyone. Over to you, Mas Chandra.
All right, thank you so much, Mas Robert, for your help on that. So, and finally, we have reached the end of our guest lecture session today. And once again, I would like to extend my gratitude to Associate Professor Riza Yosia Sunindio for the very insightful and valuable presentation and also lectures. And also thanks to the University of New South Wales for your participation in making this guest lecture a success. And also to all participants, I hope you found this afternoon session informative and insightful. And we have a lot to learn from the experience shared today by Prof. Riza. And thank you. We look forward to seeing you in the next guest lectures program. Stay safe and stay healthy, everyone. Good afternoon and happy Idul Adha for those who are celebrating tomorrow.
you for
The world faces monumental challenges. It always has. But if you look around, progress is everywhere. People are coming together, imagining a better future, working to turn ideas into positive impact. Sometimes they stumble, other times they fail. But through each misstep, mishap, and mistake, there's progress, not only for the chosen few, but for everyone. Progress is making clean energy accessible. Progress makes landfill useful. Progress empowers Indigenous success, advances healthcare, protects the vulnerable, improves quality of life for dementia patients. Progress expands access to education. We've made incredible progress, but there is more to be achieved. Our sights remain forward. Progress for all.